Dr. Mark Stoller, and I'd like to welcome you to Conversations in Primary Care, the role of diet and lifestyle in the management of diabetes, making it work for you and your patient. Joining me today is Davida Kruger, nurse practitioner extraordinaire from Henry Ford Health Systems in Detroit. Welcome, Davida.
Thanks for having me.
My pleasure. And today we're going to have a discussion, and truly a discussion, on how to effectively manage your patients with diabetes beyond pharmacotherapy. So, on to diet, which is obviously the most frustrating. New onset diabetic in the office. Who should teach them and implement nutritional and diet counseling? Should it be the primary care healthcare provider, or should it be a dietitian? Should it be a CDE? Where do you go with someone newly diagnosed in the office?
The answer is yes, all of the above. And here's the reason why. I think every patient deserves to be seen by a dietitian. And the dietitian is going to give them a plan of action. They're going to tell them this is what a carbohydrate is, this is what a fat is, this is what protein is, this is how many general calories you get, and if we break that down, this is servings for you. But it's usually once or twice they're going to see a dietitian, and if we're lucky enough to get reimbursement and we can send them back annually, so be it. So it costs about $100 to see a dietitian. A lot of insurances pay for it, many do not. But every patient deserves to see a dietitian once. Then, I think in every conversation we have to talk about it. And again, it doesn't have to be an hour conversation. Where's your stumbling block? This is Girl Scout cookie season. How many boxes do you have in your house? Don't bring them in your house. You know, if you're going to eat Girl Scout cookies, take a couple. Be done with the box. You know, those kind of conversations, it's a holiday season. You know, how are we going to get through? You know, every patient in January came back to me and said, my weight is up, I enjoyed the holiday. Okay, it's January, let's move on. So I think every conversation has to have a component of it, and it's not a negative component. It's not, oh my God, you ate such and such. It's like, okay, let's talk about what it is, what it isn't, how do we move you forward?
So for those patients who don't have the luxury of access to a CDE or dietitian, could their primary healthcare provider have a meaningful discussion either in the context of that office visit, or is there any worth to just bringing a newly diagnosed diabetic back to their primary provider and just having a diet-only visit or a wellness diet exercise visit? Is there any currency to that?
You know, I think if the person feels comfortable, the provider feels comfortable doing that, because we do that as I work with a group of nurse practitioners. There's 5 of us in our practice. We do that every visit. We use the dietitian, but we do talk every visit, or we have them come back and we're working nutrition for them around physical activity and how to incorporate medication. It's your comfort level as a provider, but you got to have some comfort level with nutrition if you're going to work in the arena of diabetes. We owe that to the patients.
So there's so much noise out there about how to eat, what diets are useful, which are not. So what about things like glycemic index? Is there any currency to that in management of diabetes? Low carb, ultra low carb, no carb? Give us your sense of those approaches.
Sure. Well, I usually tell my patients, pick something you can live with. You know, I might not be able to live with a no-carb diet, but you might be able to live with it. And what you want to do is something that's sustainable. You know, the paleo diets, the no carbs at all, they're hard to sustain. And most people can't do that. So pick something, and pick something with a support group. So I usually say, you know, there's nothing wrong with medical weight loss centers or Weight Watchers or any of those programs if you can do that and sustain it. And a lot of times, if you can take a buddy with you. So I don't think there's anything wrong with any of these nutritional programs. It's what can you sustain long term. And if they're so severe, you might lose 20 pounds, but that 20 pounds is going to come back on. So something that fits with your lifestyle, something that you can do long term, and also do it with a buddy.
So key word, sustain,
Yeah.
capital letters. And I think patients want quick fixes, physicians want quick fixes, because we're used to that with some of the other things we care for, treat in primary care. But it's sustainability. And no, you're not a caveman. You can't be paleo. And I loved your Girl Scout cookie discussion, because for some patients, the only way they can sustain is if they can have those 2 Girl Scout cookies. And I think that if that's accounted for in what we recommend to our patients, they can sustain it. So, next question. How many grams of carbohydrate should a patient eat? You know, if you were going to structure, okay, here's a sustainable diet, what's your recommendation in terms of number of carbs?
So first of all, you have to understand it's the carbohydrates that elevate the blood glucose. It's also if you're not moving, that's what you're going to wear too. So we usually say, depending on the person, the need of their weight loss, their A1C, et cetera, somewhere between 30 and 45. Now, some people can tolerate 60 per meal, but typically 30 to 45. And then people have to understand where carbohydrates come from. You know, they're in fruits, they're in some vegetables. Obviously your breads, your pastas, your some of your cookies and candies and stuff like that. So not only do we need to say that, but we think, oh, I know what a carbohydrate is. The average person doesn't necessarily know that. So you have to have those conversations as well.
Juice is natural, so therefore it's good. And
I hear that all the time. Look, it says no added sugar. Well, it doesn't have to add any. It's pure sugar. So the things we say is no juice. We really, and that's one of the things we really work with people. And I think that, sweet tea, soda pop, juice, those are the empty calories that people really get caught up in, that if we can take those out of their diets, we've made so much headway.
so I think that 120 gram is a really easy number because it's 40 per meal. And what I often tell patients is, okay, I'm putting 120 grams in your wallet. I don't care what you spend it on. You could spend it all on Girl Scout cookies, but the rest of the day is lettuce if that's how you chose to spend it. But you have 120 grams each day and you can't go above it. Choose which meals you want it at. And they can do that. Some patients, I think, need the structure of, I can only eat 40 at a meal, but I think it's a way of primary physicians giving something quick, easy, and adherable in the office without too much education, because we just don't have time.
But I also want to make sure that patients understand that if they have a bad day, that's okay. Get back up the next day and start all over. Don't beat yourself up. Because I think what happens is they say, oh my God, I ate the whole box of Girl Scout cookies, and so I might as well not do anything tomorrow or the next day till I see you, and now it's been 30 days. So saying you're going to have a bad day, or you're going to have a day that's not just 120 grams, or you went out to a party and you enjoyed yourself, that's part of life. That's okay. And making it okay so that the next day the patient gets up and starts all over again.
I give them permission in that setting because that is life, but I also let them know that you worked so hard on Sunday, Monday, Tuesday, Wednesday, Thursday, Friday, and it was hard to achieve those small things.
Right.
But then one bad Saturday, and you give it all back, and that's why you're not seeing the weight loss. So you need those days off, but you just have to be a little bit aware on your days off, because otherwise you erase all the hard work you did.
Absolutely.
What tools do you use to help patients do better with nutrition? Do you use MyFitnessPal? Do you use any other sugar books or resources for patients to make it easier for them?
I think there's a ton of stuff out there. Again, I want them not to be extreme in what they pick, but we use, MyFitnessPal is amazing because they can put in their weight, they can put in their physical activity, they can put in their water consumption, and it reminds them every day of what they're doing. And people are pretty savvy tech on their iPhones or their phones to be able to do that. So we definitely encourage them to use icons that are going to be with them that they can add to. And again, looking at recipes and learning new recipes so that you're not putting a stick of butter into whatever. And I had someone who asked them to stop frying, so they bought a wok, which should have been great, but then they were frying in the wok. So talking about those kinds of things, but we talk about healthier eating, better recipes. The American Diabetes Association's Forecast magazine is phenomenal because it has all kinds of activities in there and recipes to get them started. But keeping track of it, that rewards them, I think, on a very daily basis.
And I think it's the daily. So I don't find books either valid or helpful. You really need something that patients either access themselves or can access with frequency to be successful. I want to thank you for joining us today.
Thank you for having me.
It's our pleasure. And I want to thank everyone who's attended today's program. Have a great day.